And although Nebraska does not have nearly as many cases as other states, the New York Times recently reported that Omaha and Lincoln could become the next hotspots. The data suggests that Lincoln has an average daily growth rate of nearly 12%, with Omaha just below that at 8%. UNMC's Dean of College Public Health says Nebraska has not quite flattened the curve, even as the state starts to reopen.
There's the risk as you open up that you will get increased transmission within the community and you will see more cases. And this is why there's that concern as you open up without having that 2 weeks of decreasing cases, that you're even more likely to continue to have increasing cases.
Governor Ricketts says the state has plenty of open hospital beds and ventilators to handle more hospitalizations. Dr. Khan adds, as Nebraska reopens, there needs to be more testing, contact tracing, and protection for healthcare workers. He says implementing safety guidelines for long-term care facilities, packing plants, and schools is essential as well. Khan says just because the state reopens doesn't mean the pandemic is over.
And at best, maybe 5–10% of Americans have been infected. So 90% of Americans are still susceptible to this disease. And so as we go out and about, the most of us are still susceptible. We should expect to continue to get rounds of transmission within our communities.
The New York Times also listed Grand Island as one of the hardest hit cities in the country, with roughly 16 people testing positive for every 1,000 who live there.